It is now my great pleasure to announce that the Southern New England Conference, through a collaborative effort by 122 congregations, 4 associations, and more than 100 individuals, has now abolished $26.2 million in medical debt for those least able to pay it themselves. We have been able to do this by raising just over $200,000 and turning it over to RIP Medical Debt, a New York-based nonprofit which buys up medical debt for pennies on the dollar in order to forgive it. When we launched this effort in January, our initial goal was to retire the debt of people in need in our own region, and we did that, buying all the debt that was available here. $8.4 million in 7,175 households in 65 counties in Connecticut, Massachusetts, Rhode Island, Maine, New Hampshire, Vermont, and New York. But thanks to the generosity of our churches, we had much more to give, so we made a second purchase, eliminating another $17.8 million in debt for 12,144 healthcare workers and first responders across the United States. This was done through a new fund that RIP Medical Debt created in response to the current pandemic, the Helping COVID Heroes Fund. We are thrilled to be one of the first organizations to contribute to this fund. Specific criteria were used in both of these debt buys. Qualifying debtors were those earning less than 2 times the federal poverty level, in financial hardship with out-of-pocket expenses that are 5% or more of their annual income, or facing insolvency with debts greater than assets. A yellow envelope bearing a United Church of Christ logo is on the way to each benefiting family with a letter naming contributing congregations and organizations. It reads, in part, "You may never enter the doors of one of our churches, but we are the United Church of Christ and we love you. Most importantly, you are beloved by God and your debt has been forgiven." Our fundraising effort here in Southern New England is part of a larger effort by the entire United Church of Christ, which has to date abolished $51.8 million in medical debt. Previous efforts have taken place in Chicago, St. Louis County, and the East Bay area of California. This campaign will continue in various regions across the country. Our scriptures call us to bring good news to the poor, to proclaim release to the captives, to let the oppressed go free, in the midst of a pandemic that is disproportionately impacting communities of color, and with widespread unemployment causing people to lose their insurance just when they may need it most. Eliminating medical debt for vulnerable individuals and families is a tangible way in which we are responding to our call to make God's love and justice real.